Thank you, everybody, for being here this afternoon. This has been a terrific conference so far, and I look forward to continuing that conversation this afternoon. We're going to switch gears now and talk about concentrated animal feeding operations, or CAFOs. That is a legal term of art. We are not going to be using it necessarily in that legal sense, however. It's just shorthand so that we're all on the same page about what we're talking about. My name is Michelle Nolan. I'm a clinical professor of law and supervising attorney with the Environmental Law and Policy Clinic here at Duke University. And I just want to try to frame this in terms of one of Duke's mottos, which is knowledge in service of society. And so for that reason, I'm really, really happy to see so many academics, so many students from all different disciplines here in the room today. And we're joined by regulators, by farmers, and by community members. And it's just really gratifying to see all of those people from bringing different perspectives and different experiences to the table for talking about this important problem. So I'm going to steal a little bit of a process from Bill Ross, our esteemed colleague here, former Secretary of the Department of Environment and Natural Resources in North Carolina, where yesterday he spoke about the Clean Smokestacks Act in terms of chapters. And so I'd like to borrow that rubric for approaching the issue of CAFOs in North Carolina. So I'd like Chapter 1 to begin back in the late 1980s and 1990s, before some of you perhaps were born, certainly before many of you lived here in North Carolina. And at that point in time, we were seeing dramatic transformations of livestock production in the United States as a whole, but particularly in North Carolina around hog production. And this was coincident with the opening of the Smithfield Food Slaughterhouse in Bladen County. At that point in time, there were many complaints from members of communities where these hog operations were being constructed, where traditional farms were being expanded to the CAFO model of production. And those complaints fell on deaf ears, not just on the deaf ears of regulators, but also on the deaf ears of the environmental community, with whom many of those community members thought a good partnership could be formed. And no action, no advocacy, no action was taken in North Carolina until 1995, when a series of catastrophic spills of hog waste storage lagoons took place across the coast of North Carolina. And at that point in time, that triggered a flurry of activity where environmental groups decided that they did need to get involved. Community members came together, and Governor Hunt convened what is now called the Blue Ribbon Commission on Animal Waste. And what we learned during that process was that the state's livestock agriculture profile had changed dramatically, pretty much while nobody was watching, and certainly no one was paying attention. During that time, many facilities had located across the coastal plain, but regulators did not know where they were because they were not required to register and there was no permitting process in place. Some of the recommendations that the Blue Ribbon Commission came up with were immediately acted upon, and among those were the development of some sort of regulatory oversight program. And so North Carolina became one of the first states in the country to develop a comprehensive overview regulatory program for livestock operations, the centerpiece of which was a certified animal waste management plan to be prepared in concert with assistance, both technical and financial, from the Natural Resources Conservation Service, a subdivision of USDA. North Carolina's model was considered to be a gold standard for regulation of this industry, and it's no surprise then that when EPA finally did develop some regulations pursuant to the Clean Water Act at the federal level in 2001, those regulations looked remarkably similar to North Carolina's. They included that certified animal waste management plan. They included some management measures for lagoon maintenance. They also included some prohibitions on when waste could be applied. So that you would not be having waste sprayed onto agricultural fields during rainfall and other adverse weather events. But then you go forward to 1999 when Hurricane Floyd hit, and we saw disaster hit North Carolina again because many of these facilities that were now covered by a regulatory approach were located within the floodplain. And so facilities were flooded, lagoons were flooded, animals died, and there was significant hardship, not just on the part of those downstream communities, but also on the part of the agricultural producers themselves. In the wake of Hurricane Floyd and that aftermath, then Attorney General Mike Easley entered into a very innovative agreement with Smithfield Foods, one of the industry leaders in the United States for hog production, to do a study of animal waste management technologies that would provide some measure of relief to communities and to the environment. And Mike Williams is here today to speak with us about some of that research and the ongoing research that he and his lab continue to do. We'll also have later on a conversation from the Duke Carbon Offsets Initiative about a waste-to-energy proposal project that may also offer some relief both to communities and to the environment. So that brings us forward to Chapter 3 in terms of what we have learned about the industry over this last 20 years of attention in North Carolina. One of the things that I've learned is that there is great exceptionality in the law for the regulation and oversight of the livestock industry. There are significant exceptions under the Clean Water Act, the Clean Air Act, the Resource Conservation and Recovery Act, which we heard a little bit about in the earlier coal ash discussion today, from FDA oversight for the use of pharmaceuticals in animal production, and we'll have several conversations about that this afternoon as well. There are exceptions to labor and occupational safety standards for the industry. There are exemptions from basic protections for communities and nuisance and zoning laws. And there are also exemptions from disclosure and other protections, proprietary contracts and things like that, that leave farmers very vulnerable and make their situation extremely difficult between trying to earn a profit, hold on to their own family land, and do right by their communities. Through all this work, I've also learned a lot about the people, about the communities who are affected and the farmers who are trying to make ends meet. I've met lots of people, some of whom you will hear about and meet today, who've been on their land for more than 100 years. Some of them are farmers themselves or former farmers. And I've learned a lot about concepts and the realities of environmental injustices within our communities where many of these facilities are located. I've also learned, I think most importantly, that there is an extremely high cost of the cheap food that we enjoy here in the United States. Chapter 5 is the comparisons with coal ash, and I learned a lot in the discussions earlier today about the similarities between coal ash production and waste storage and the concerns facing CAFO waste storage. Similar problems in terms of where they are located, in terms of leaching and spills and of siting. And this perhaps is not terribly surprising, considering that both coal waste storage ponds and manure storage ponds are governed by the exact same set of regulations here in North Carolina. I also saw in that discussion earlier that it similarly took a disaster in terms of spills and catastrophic impacts to get the attention of regulators and the industry to come to the table and try to craft solutions. But in contrast to the coal ash situation, we've heard earlier today that there are between 1,000 and 1,500 coal ash storage ponds across the entire United States. Contrast that with hog waste storage lagoons, of which there are more than 3,000 in North Carolina alone. Across the country, there are many significantly more. There are also waste storage lagoons for dairy waste, for beef cattle waste, and in contrast, very few requirements at all over poultry manure storage. So this is a significant problem, the dimensions of which I think go far beyond that experienced with coal ash storage and concerns there. Another difference is in the level of response. The quickness of the response, the level of study that we see devoted to this issue, and the response of the government in crafting comprehensive regulations. There are, of course, many defects about that, which we heard about earlier today, but at least there is a comprehensive regulatory approach to try to deal with the problem and a significant amount of scientific study into the public health impacts and environmental impacts. So that brings us to Chapter 6, and that's where we go from here. And I invite you all to write this chapter with us together. We need to be in a position where we can move beyond divisive litigation, which can be very uncertain, very expensive, and many of the communities who are most adversely affected by these concerns lack the resources to be able to go toe-to-toe in the courtroom with some of the corporations that own the hogs and dictate the waste management measures of these facilities. We need to come together to find common cause with farmers and with those affected in the community and bridge the divides between science and policy, between academics and advocates. We need science, policy, and law to come together to solve what some have called the 5 flying monkey problems of food animal production and the concerns that they pose. So I hope that together through the conversations today, we can begin to listen to each other more closely, identify areas where we have commonalities, and we can come together to craft solutions for our communities and our environment, and live up to what Duke likes to see in terms of putting knowledge to service to the benefit of society. So with that, we are going to switch to the substantive presentations. First, we have Dr. Chris Haney with the Johns Hopkins School of Public Health in Baltimore, and Mr. Devon Hall, who is the executive director of an organization called REACH in Duplin County. That conversation will then be followed by May Wu, a Duke Law alumna and attorney with the Natural Resources Defense Council, who will talk about FDA approaches to regulating the use of pharmaceuticals in food animal production, and then our own Dr. Julia Kravchenko, who will talk about some of the public health impact research that she's been doing. At that point, we will take a bit of a break to answer questions from the audience before transitioning to talk about some of the technologies and how those might be able to be deployed to address some of the concerns we'll hear about earlier. So thank you very much.
All right, thank you, Michelle. That was a great overview. Thank you for having us. Thank you for inviting me and Devon to come speak today. We've spoken at events like this, and we've talked a lot and presented what we do. And we try to do a tag team. And I'm coming from an academic setting. And the kind of research that excites me the most is research that is critical of who's funding the research, what questions are put forward, and how those questions target issues that people think are important that end up contributing to scientifically generalizable knowledge through the peer review process and literature. And so one of the things that Devon and I thought we would do today is to think about and to present to you why, in some of the science that we're going to talk about, why we focused on this science versus other ways of approaching research and the research questions. And it really has to do with, as an academic, me spending time listening to the community and hearing from the community about the challenges of things that we might learn about in academic settings, like the study population or the target population or the source population or location and geography and things. And all those things really matter, and I think we'll do in the beginning is to have Devon, if you would share a bit about your experiences in the community, the history of REACH, and kind of what you've done and what brought you to be interested to call me on the phone and start doing research together.
Again, thank you for having us here today. REACH was founded in 2002 to address, issues actually that we noticed in Duplin County, mainly after Hurricane Floyd, realizing that there was a lot of resources that we wasn't aware of. Duplin County is home to roughly 2.2 million hogs, produced annually. And that was a great concern when we could see, hogs and chickens, floating down the creeks and streams. In 2004 is when I was actually introduced to Dr. Steve Wing, actually, which was doing a research project. And I'm an electrician by trade. And there was a lot of questions that we in the community had when it comes to environmental justice, health impacts, and what we could do to, protect ourselves. And just by participating in that research project with Dr. Steve Wing, it just kind of sparked my interest. What can I do now to help empower and mobilize the community in which I live? That kind of led me to Dr. Chris Heaney. And from there, I recognized that there was more work that needed to be done. In 2007, REACH received a small grant. 2007, we received a problem-solving grant from US EPA, which in fact we invited all the stakeholders to the table to address the issue of swine production. And with that, I remember hearing a representative from the industry stating that if it wasn't for the odor, we wouldn't be here today. And that really hit kind of hard to me, and it made me even more want to be involved with research to find out just what the negative health impacts was, and again, how I can more protect the community and the people I serve.
So Devon, tell them a little bit about how we got to the point of being interested from the fence line concerns and the neighbors to doing some of the current work we're doing with workers, and maybe the campaign that reached out with the blacks and browns.
Realizing also that in Duplin County, and we've noticed that many of the workers on the farms is Latino. REACH's office, we purchased the land, placed our building in the center or the heart of the Latino community. And that's not easy. Chris and myself joke about it sometimes about how even in the African American community, there's always a trust issue when someone from the outside comes in. We found that to be the truth with the Latino community as well. I lived there, within a mile and a half of the REACH office. And I can remember at one point when we was trying to purchase land to place our building, a Latino family came to me and said, Devon, you need someplace to put your building. It's a double wide mobile home. And we searched, long and far to try to find some place to place that facility. And just to have a Latino family to approach us and say, look, we need you, just like you need a place. And realizing that, again, we reached out to researchers, Dr. Heaney, and we recognized there was work that we could do together.
Yeah, that's great. And Devon, let's hang out together and as we go through stuff. Let's keep the conversation going because, I came and got to know Devon as a graduate student. I was in graduate school at UNC Chapel Hill doing work in epidemiology with faculty mentor Steve Wing. And you guys were doing very elegant work around near neighbor air pollution concerns and connecting air pollution exposures to various health-related quality of life issues. And it's all related to the context in North Carolina, related to its contribution in the state and the world in terms of meeting global meat demand. There's a huge demand for meat products globally. We are driving in the U.S. and other Western countries are driving a lot of that, and it's not going away. And these are concerns that have led to a certain distribution in the U.S. of various types of meat production. We've got cows, we've got broiler type and other meat chickens, turkeys. And if you start to look at North Carolina, particularly with hogs, and you ask why Steve Wing, why others, why we're here today at Duke to think about North Carolina, there's really a unique concentration of food animal production in this state. And you've been noticing this transition, and people in your community have been noticing this transition for a really long time.
You look at the map here, and, it's pointed out North Carolina. But I see something a little bit different. I look at Duplin County where I live, and I don't know, if you can, yeah, there it is. That red blob there, again, I was born and raised in Duplin County. And when you look at that map, can you find the borders of Duplin County? So that's why, it's a great concern to me. I have children and grandchildren. I was born and raised, again, like I just stated, in Duplin County, have no desire to ever live anyplace else. So what is Duplin County going to look like for my children and grandchildren? So again, this really, hit home to me. Why North Carolina? Why Duplin County? And what can I do to help protect it?
And I heard that as a graduate student. What can we do together? Some of the tools that I was learning were of the research variety. So we started to think about what research had been done. This map is from an analysis that Steve Wing and some graduate students had done that just asked a simple question. If you looked at where the permitted industrial hog operations are located with their lagoon and waste management systems in North Carolina, and you overlay demographics of percent individuals living in low wealth or percent people of color, you found a trend. You found that these facilities were located in areas with higher poverty and higher percent of people who are of color. So this is a model of animal production that is quite impressive in terms of its vertical integration, its efficiency of scale, and we, over the years and even in the past few weeks, have had sort of a look back and saying it is quite astonishing what we are doing in terms of our capacities for food animal production. And this is a model that is for whatever our perspective may be, is here to stay. So we have to think about the context, and when we think about what can we do, we think about the situation, and this is from a flyover from some of the partners that you work with and others work with at the North Carolina River and Waterkeepers Association, and you see kind of an exposure scenario like this that's led to some of the air pollution research and the near neighbor analysis in relationship with hydrogen sulfide. But you also have watersheds, you have other animal production with cattle here, with the land application of the swine lagoon waste, and you also, as we were thinking and working with other partners, had an awareness that these are facilities that have problems and individuals have to work at these facilities in order to manage the production of the wastes. And that started the conversation with Devon and the outreach and the work you were doing with Hispanic and Latino communities and trying to think about, do we know who is not only living near these facilities, but who's working in the facilities? And that's kind of the dual aspect of our work that we started to get going, within a very complicated exposure scenario with a lot of different attributes. And I think for the rest of the talk, what we're going to share with you is not to, as Michelle very nicely laid out a history, there's a lot of elegant work on air pollution and other issues, but we focused on the environment and microbial contamination. That's probably a bias of mine coming in. I got my training at a microbiology lab, learning how to hunt bacteria and viruses in water and different media. But there's a story there, particularly with food animal production. When we think about, in the United States, the latest data from FDA in terms of tracking the Center for Veterinary Medicine about the antimicrobial uses in the United States, there's a large amount, by quantity, by weight, of antimicrobials that go into food animal production. In fact, if you start to break it down by class, tetracyclines, lincosamides are a big contributor in terms of production. And if you think about human versus animal uses, this is an often disputed number, but the proportions generally are that there's a larger proportion of antimicrobials in the U.S. that's used towards animal production than there are for human clinical medical uses. So learning that from an academic perspective as a student and thinking about what's going on in Duplin County with a lot of the awareness about the environment and the workers is kind of where we started some of this work. And we started thinking about a water study and how could we endeavor to collect water samples in a way that could lead to new information about the way that the waste is land applied and the permits which state non-discharge and some of the studies that we did there. Maybe
Just me being here and standing in front of you today, I'm not a doctor, a scientist, a lawyer. I'm just plain me, Again, as stated, I licensed electrician. And in 2002, we saw the need to form a nonprofit organization to address the issues that we just had to have some answers. But I'm also a fisherman, used to fish a lot anyway. Creeks and streams, my preference. I'm a hunter as well. And I can remember, catching fish with sores and boils on them and had no clue of what it was. But I did know that there was a swine facility maybe 300 or 400 yards upstream. I can remember going on countywide water because I had a surface, my well was only about 35 feet deep. I drilled a well myself, and I thought I had pretty good water. But again, when reaching out to researchers, there was always those type of questions, what can I do? Not just protect myself, but the people that I serve and the community I live in. And then we began to recognize that we had to reach out to and recruit more people in the community to do some of the work and to help us answer some of the questions that we had.
And one of the basic questions that I heard from Devon was, could we set up a study that could investigate whether or not fecal pollution of a microbial variety is leaving the sites of the land application of the lagoon waste? So we, through REACH, reviewing aerial photographs with other partners who were helping review site selection, tried to endeavor to find sites where there was a lagoon waste spray field that crossed a public road right-of-way, that had a creek on either side of the public road right-of-way where trained community organizers could follow the aseptic method with using water bottles with gloves and collecting water samples and then submitting them for testing for various microbial contaminants. And to do this with REACH and their organizers who are in the community living there every day, year-round, and do this sampling weekly for 6 months and monthly for another 6 months for a full year. And that's what we did, and we had a series of studies that came out. The first showed that we found swine fecal wastes that are called source tracking markers. We can take advantage of the microbiology of these organisms and know that certain bacteria like Bacteroidetes co-evolved with the swine in a unique way that through a DNA marker that we can detect, we can see whether it's present, and its presence is highly specific towards swine fecal pollution. So for one of the studies with the water samples that Devon and REACH collected, we found evidence that there was these swine fecal source tracking markers. Pig 2-bac is one of them. It's a pig-specific Bacteroidetes that was off-site in the creeks and the streams running from these places where the lagoon waste was sprayed. Fecal indicator bacteria we also found hepatitis E virus. There's only 2 other reports in the world. 2 of the other reports are in Asia about hepatitis E virus, which is a unique swine zoonosis in the West. In South Asia and other places, there's a human genotype, which is from poor sanitation conditions. But here in the U.S., the source of hepatitis E virus is swine, and we found it in surface waters in eastern North Carolina, in Duplin County, and it's one of the first reports of that. We also had it was a crazy idea. It was just sort of a hunch. We had a graduate student who was doing all of this water sampling work, and we were paying attention to what was going on in Europe with antibiotic-resistant Staphylococcus aureus in swine production workers and their family members, and we said, what if we could try to get the graduate student to run an extra plate for Staph aureus and MRSA? And we did, and it really opened up a lot of extra work, which was we found Staph aureus in the surface waters that the REACH organizers collected. It was of the drug resistance variety, and we also used several characteristics here, and try to follow me. We're looking for MEK-A to say MRSA, the methicillin resistance, or MRSA. We look for this gene, and if it's not there, it means it's a Staph aureus that most likely adapted to an animal host, like a pig or a hog. And if it's there, it's very indicative of like a human evolved Staph aureus. So if it's absent, we say it's an indicator of livestock adaptation. And then we have some clonal complexes. From Europe, we saw that Staph aureus was coming out. There was this ST398 or CC398. So that plus in North Carolina and Asia, there's a clonal complex 9. So we said if it's one of those, it's also an indicator of a livestock adapted Staph aureus. And then going back to FDA data, the antibiotics going in, tetracyclines are going in the feed. So if the bug has resistance to tetracycline, maybe that could be a specific marker of a recent animal source like pigs. And then finally, if we're not seeing a MRSA story, would we need to look at a broader drug resistance story? And we came up with a definition of multi-drug resistance, or 3 or more antibiotics. And we call that, this acronym, MDRSA. So for the rest of the talk, we're going to focus on some of these. And in the surface waters, we see quite a bit of drug resistance, and also quite a bit of this SCN negative, which is a marker of livestock association. So some evidence starting to come out from environmental work in the surface waters about Staph aureus being there, and also drug resistance, and some indication that it could be coming from livestock production or from an animal source. So that kind of kicked off a lot of thought, didn't it? And we were thinking about the environment, the potential for community exposures. Devon talked about fishing, but we also started thinking a lot about other potential sources. And could any of these exposures be related to health? And that got us starting to follow some other work, and this map is not showing up, but a group at Hopkins in Pennsylvania was starting to generate evidence on this as well, and just looking at distance from living from a CAFO, from a hog CAFO, and looking at the hospital records of MRSA infections and skin and soft tissue infections, and found that the closer you lived to one of these hog CAFOs, the more likely you were, the higher your odds was of having a skin and soft tissue infection or MRSA infection. Now that's this kind of ecological, spatial association, but we were paying attention to that and thinking, here we are, myself with some ability to do some research, reach with connections with people who are on the ground, living next to and working in CAFOs, and we started to think about whether or not we could do studies with workers.
What better group to, begin to partner with, the workers? Because what we find is not only do they work in the facilities, but they live in the community as well. Just like I live in the community, but I don't work on the farms. Again, when I'm thinking of protecting myself and my family, then you have another group that, again, appears that their voice is not being heard. They're concerned as well about their health, but there's no one there to speak for them. So I felt, very passionate about, Chris, what can we do? And it was a challenge because, again, we always think of the trust issue, but then you're working with a group that it could jeopardize their jobs.
And tell them a little bit about why, because we, from the research side now, know a lot about the group who's inside doing a lot of the work to produce the animals, but you knew stuff just through looking around the community.
Well, sometimes, we're looking at, we're thinking about, the documented people, but there's also those that's undocumented. Well, to me, they're just people. They're human beings. And regardless, when it comes to public health, if they're working in facilities, they need to be protected as well. Many times we don't view them or think about them whenever we're sitting down at the dinner table. Whether you're eating pork, beef, chicken, it don't matter. You don't think about the people that's working in these facilities. You don't really think about whether or not they're documented or undocumented. You're just enjoying your meal. But what if you were sitting across the table from that individual? And at the same time, what if it were you that was working in those facilities? I had to work in that facility to take care of your family. So it kind of, it struck home to me, and I really wanted to do more. So just being able to, and looking at the challenges that we had, getting the workers to participate in this research, and realizing there would be all types of struggles, and that sometimes, this is in 2014, and the outbreak of PED, the PED virus. And then we begin to hear stories from some of the workers, they wasn't allowed to have company over. The local hardware stores that I noticed, you walk in the store and there's a mat, in the front, warned you to make sure you clean your feet. Workers were saying that, hey, even if they came to one of our community meetings, that we had to have a chlorine, Clorox solidified container so they can spray the tires, on the vehicles. So you putting all that extra on this group of people because you don't want them to talk to myself and researchers. That, again, was a great concern. What do we do next? The work is needed in order to protect people and to help people. And I couldn't do this work on my own. We needed the researchers. We need Johns Hopkins. We needed UNC Chapel Hill. And in this case, standing here today, we need Duke University.
Yeah, and Devon talked a bit about what you were already seeing in terms of who the individuals were who are working in the facilities. And in epidemiology, we were learning about the context or the kind of the vulnerabilities of groups. And so we started to dig into the numbers a little bit to look at, in the U.S., what's known about the numbers of individuals who are working inside of these animal production facilities. And it's pretty tricky to get a handle on the estimates. Some of the best estimates we could find are that there are roughly 850,000 industrial food animal production workers in the U.S. Estimates of about 54,000 of these may have direct contact with the animals in terms of the daily interactions, the daily challenging job of producing and raising the animals. We do know that from others' work that they're geographically concentrated in the U.S., and that got us thinking about the opportunity in contributing the knowledge given what REACH is doing, populations they're reaching out to in North Carolina, who are rural, diverse, racial ethnic populations. They're low income. They have a high distrust of medical and health research. There's, in our experience, not a whole lot of cooperation on the part of the industry in terms of the employers, in terms of trying to investigate public health or environmental health or occupational health issues that are affecting either workers or neighbors. And as Michelle alluded to, there has been an effort to organize and to form unions in the processing plants in North Carolina and elsewhere for hog production, but there's no unions in the actual facilities that are producing the animals, and that's another challenge for the workers. There is, as far as we were hearing, and now we know, a concern about a lack of access to health care and healthcare systems. So that really is the context, the epidemiologic context. If you want to ask a question, would you have a null result if these are the factors going on with the population that you're trying to study? So that had to drive context about thinking about methodology that we might utilize to get over that challenge. And we think about building partnerships with community organizations as one of the only ways to generate knowledge and to contribute to scientific knowledge in those areas, if it's not coming from other places, that is. So we've reached out and we followed principles of CBPR, community-based and participatory research, where Devon is at the table, members of the REACH staff are at the table who are former, current hog operation workers, poultry production operation workers, and are helping decide which research questions we chart out in terms of looking at occupational health concerns. So here's some information plugged for Devon to get in touch with REACH. This may be an older website, but you can also follow up with Devon here. But this is, I think, the context, and I think today in our audience it's important to think about the methodology, and if we don't follow or aren't open to working and partnering with community, would knowledge be advanced in certain ways? So Devon and the members of REACH have been very active in this space for a long time, but we specifically were focusing on this issue of people are engaged in the activity of producing hogs. People carry microbes like Staph aureus. They can transmit them to pigs, and we know that that's the case. Pigs can either carry Staph aureus of their own or pick up Staph aureus and other microbes from people. But the antibiotic use and the antibiotic inputs may be quite different for the pig than humans. Are we, as parents, or every morning as adults, getting up and eating tetracyclines as a part of our feeds, say cereals, as opposed to a pig? That is going on. And if that's going on, then we can have selection of the microbes, where the pig's microbes change in critical ways under that pressure of antibiotics. And then if humans are working with pigs and there's close contact, pigs can transmit bacteria back to them. So that's the concept, and that's the idea that we wanted to try to shed light on and try to contribute to knowledge. And whether or not, the central question we're focusing on is whether or not microbes that the human workers were carrying could be traced back to pigs. So we did do all of this without access to the pigs and without access to the facilities. But I'll just kind of walk you through some studies we've done and the study designs and the questions we tried to set up. First was, in epidemiology, you don't dive into a longitudinal study. You ask a cross-sectional research question. One point in time, are there two groups that you could contrast, and it could elucidate something or reveal some trend? And so we had the idea to work with Devon and members of REACH to recruit a concentrated animal feeding operation worker group, or we called it an industrial livestock operation worker group. And we said, what would the nasal carriage of individuals, if we swabbed their noses and asked if they were carrying Staph aureus, what would it look like? How frequent would they be carrying it? And what would the drug resistance profiles be? So this is the CAFO exposure group. The darker cells indicate degree of drug resistance. So there's that pattern there. We had a separate group in our cross-sectional comparison, which we worked with other partners to recruit antibiotic-free, pasture-based livestock operation workers. And these are a burgeoning field. If you look just around Durham here, there's a barbecue festival coming up in terms of thinking about pasture-raised pork production, and could that feed us, and could we have a different network and a different way of producing pork? And now it's our second group. So if you just look at the drug resistance patterns, there's a higher frequency of drug resistance in the upper panel, the CAFO worker group. And if you take that marker of livestock association of that SCN negative, that panel right here, it's a big panel in the CAFO worker group. And these are the people, these are the workers. And the Staph aureus that they're carrying in their noses is looking like livestock adapted or livestock associated Staph aureus. In the antibiotic-free worker group, it was there, but it's a much smaller proportion. And the drug resistance, if you look, is more skewed towards the kind of typical human carriage Staph aureus. If you look at the drug resistance pattern in the CAFO group, it's clustered down below in the animal adapted or livestock associated Staph aureus. So we didn't have access to any pigs. We had to do this under just sort of molecular epidemiology, thinking of attributes of bacteria, but it's starting to reveal a pattern. So that's cross-sectional. The next thing that we decided, could we convince hog operation workers to agree to be in a longitudinal study for 14 days, and could we look at the question of whether they bring it home and how long they carried it in their noses? So that's getting at temporality, and we had this 14-day study where Devon, we had training sessions to sit down with the hog operation workers about what they could do, and all of this engagement, by the way, is off-site of the workplace, at their homes or working off-site with the hog operation workers at great risk, I would say, for them. But they did successfully agree to a protocol where they would swab their noses in the morning before they go to work, and in the evening after they got home from work. And some days we asked them to only enroll when they anticipated not going to work. And that resulted in the study design where people had up to 4 days away from work. And the question was, what Staph aureus would they be carrying in their noses, and for how long would they be carrying it if they had time away from work? And so that led to this study that showed, in this context of the window of 14 days, these workers were carrying the Staph aureus with them persistently over that period. And the longest time that workers had off work was up to 96 hours or 4 days away from work. So that has led to some awareness about taking it away from the work site. We still haven't sampled a single hog, haven't gotten access to any facilities, but the temporality in thinking about epidemiologic study designs, we could say something about workers are not just at their jobs, they're going home, they're interacting with their community members. So that kind of brought us to, and REACH had already been in this space in terms of thinking broadly about CAFOs, about what could we say about children's health. So maybe you could say a little bit about that.
Again, in just partnering with John Hopkins and Chris, and just think about it, CBPRO, from the very beginning, Chris didn't just draft a plan and come to REACH and say, here it is, just do it. We worked together and put together a project plan, even had former livestock workers at the table. And in many cases, we knew that, as parents, just as myself, that, the workers were concerned about their children. If they worked in facilities, what were they taking home to their children? And I can remember one lady saying that, she noticed that the sow was getting sick. She noticed herself getting sick, and she sometimes, wondered if it was food that she was eating, not realizing that it may have been the exposure from the facility itself. So again, even with the 14-day study, and we had a very limited number of people that we could enroll in that study, there was always more that wanted to be involved. People was concerned about what they was bringing home to their children. So again, that brought on the greater study, on the broader study with Chris about how can we do more, how can we enroll more families, more children, above the age 7 and below age 7.
And given that it was a new population and interest in children, we had to go back to our basic 101 epi study design to do cross-sectional, to think of 2 different groups. If we're going to focus on children, that's what we did. We thought about, could we enroll industrial hog operation workers and enroll with each worker only if that worker had a child in their household that was under the age of 7 years. We were interested in very young children. And that would be one group, those pairs. And then we said, could we enroll another group just who live in the community? And we would use the top 10 hog-producing counties of North Carolina to enroll both of these groups, the hog operation worker and their child, and then the community resident adult and their child. And that's what we did. And the same question goes about, would the prevalence of the Staph aureus and the drug resistance of the Staph aureus in the hog workers and their children be of a different variety than people who are just living in the community? And what we found is that the hog operation worker children had a much higher prevalence of antibiotic-resistant Staph aureus. Staph aureus in general, and also antibiotic-resistant Staph aureus. And the most interesting finding here is actually for MRSA, or MRSA. So here we show that there are elevated prevalence ratios for both Staph aureus multi-drug resistant, remember 3 or more antibiotic drug class resistance, and then MRSA as well. But we're going to go back to the panels here, okay? The hog operation worker panel over here on the left. The length of it is the number of individual hog workers who carried Staph aureus. So it's the longest panel. They had the most Staph aureus nasal carriage. You also look at the drug resistance panel then here and the length of the community reference group. These are the adults. But really what we were trying to get at is the children. And the children of the hog operation workers had the highest prevalence of drug-resistant Staph aureus in their noses, and MRSA prevalence of nasal carriage of 14%, which if you think about U.S. general population estimates of MRSA nasal carriage, even in children in the high end it's 6%, and that's what we saw in the community reference group, is a 6% nasal carriage prevalence in the children who are just living in the top 10 hog-producing counties in North Carolina. So that's something that Devon was really interested in. But up until this point, all of those studies, even though we're starting to get at special groups in terms of thinking about parents' concerns about children, it's still generally epidemiologically thinking on the exposure side or the independent variable side. And our next questions, I think all of us were wondering, could we generate any evidence about, is nasal carriage, if Staph aureus is in your nose, in the context of hog production work, and we're saying it's an animal-adapted strain, would it really be a concern for people? Or is it just sort of a background opportunistic hitchhiker in a way? And so that's a big question in this research field that's unresolved. And if there is an answer, it's probably leaning towards the fact that these Staph aureus strains from animals are benign and are not well adapted or well suited to cause infection in humans. So we had that same question. And we had this larger, went back to our longitudinal study, and we call it the 4-month study, where we convinced hog operation workers were brave enough to volunteer for a project where they would enroll, and 103 hog operation workers enrolled, and we had 80 of their household members who agreed to be followed up over 4 months. And we're still in the process of reviewing a lot of this data, but from the baseline visit and enrollment, we asked them about whether or not they had a skin and soft tissue infection. And we knew their nasal carriage status of Staph aureus. So we had participants report from the time of the interview in the prior 3 months whether they had skin and soft tissue infections and whether a doctor had confirmed it for them. And based upon work in Iowa that Tara Smith at the time was doing, who's another really brilliant researcher who's contributing to the state of knowledge in this area in the U.S., she used these pictures, and she shared the pictures with us to get at the typical clinical presentations so the workers could see and know what they're being asked to think about, not just some pimple but it's really thinking about a more serious skin and soft tissue infection. So we see here about a 6% prevalence in the workers who reported a skin and soft tissue infection, but in their children, the minors, an 11% prevalence of this at baseline. Doctor confirmation, lower, as we would expect. It's a more stringent or specific definition, but in this population, going back to the epidemiologic context, we had to wonder how many people are going to the doctor and actually getting those services to be able to have a doctor-confirmed infection. So these are small numbers. This study was set up to look at changes over time, but we're able to provide some insight about just from the baseline study visit and give a prevalence of SSTI. Okay, the workers did not know what their nasal carriage status was at the baseline enrollment visit. We took a nose swab. It took weeks to months for us to get a result. So they're blinded, we call that, to their exposure status of whether they have Staph aureus in their nose when we're asking them questions about their infection outcome. So here we have the benefit of blinding in terms of going back and saying, among those who turned out to be carrying Staph aureus in their noses, were they more likely to have been the ones who reported a skin and soft tissue infection? And clearly for Staph aureus overall, we were interested in that. We're interested in multi-drug resistant Staph aureus, but most importantly in this field, would the SCN negative, or what we're calling the livestock adapted strains, be associated with the skin and soft tissue infection? Here, these are pretty strong prevalence ratios, even with a small number of observations. So we just got this work published last week, and we're pretty interested in that contributing to the discussion on this topic in the US. Also, we're very interested in learning about the workers and their availability of protective equipment such as masks or other things, and we see some evidence here that wearing a mask or not wearing a mask, if individuals are reporting at baseline that they don't wear a mask, either sometimes or never, they're the ones who are more likely to have carriage in their noses. So it could be some kind of a modifiable intervention factor, and we're interested in that more. So I'll just close with, we started from the environment, we went to what we were learning from Europe about a very interesting interest in drug inputs, antimicrobial inputs in terms of Staph aureus. But this is broader, and we've spent a lot of time in this area, Devon, but it's broader in terms of more than just Staph aureus. There's a multiple pathogen story here. Even beyond pathogens, there's a lot of impacts and concerns, but we're starting to move beyond just Staph aureus and thinking about the multi-microbial exposure, looking at influenza, hepatitis E virus, and also indicator markers like pig two-back. Remember in the water studies, we use pig two-back in the fields near the land application sites? Well, we're detecting pig two-back and finding it's highly useful in terms of it turning up in the workers' noses. And we see the multimicrobial exposure picture coming into clearer focus in terms of the industrial hog operation worker. And this is all exposure through the lens of a nasal swab that we're getting and trying to look beyond just one organism. And so, I'm still here on a slide with microbes, and I'm aware of that, but that's sort of the expertise that I brought to the table with Devon and Reach, and I've tried as a researcher to think creatively about skills that I've picked up or learned, and been open to the questions of a community and sensitive and aware who's helping the community pose research questions that they may have, that they may see in their community unfolding in a population that they may see may be doing some work in facilities that may not be covered by other research going on, say, in North Carolina or the United States in general.
In the aftermath of Hurricane Matthew, I'm always asking a question now, what can our local government, local health department do to help protect people in these vulnerable communities? The Sunday afternoon following, the impact of Hurricane Matthew in Duplin County, I observed children playing in flooded streets. And, immediately, flag just went off, and lights went off in my head, Do they realize, that may be playing in contaminated water? Even when there was a school closing or closing early for whatever the case may be, there's an app, I get a call on my cell phone. So I begin to wonder, what do our local government, our state government have in place to help protect people? Again, in vulnerable communities like this. We've got to do more.
Thank thank you so much for your time, for the invitation. Appreciate it.
All right, thank you. We're going to defer questions until the first public health segment has concluded. So we're next going to hear from Mei Wu with the Natural Resources Defense Council.
Hi, good afternoon. Thank you so much to Michelle and Duke University for holding this really important forum, and for all of y'all for coming out here and taking time to talk about these really important issues. And I want to start with a little story. So I had met with a physician in Philadelphia a couple years ago, and he told me a story about a patient of his that he had. He's a roofer who had fallen off a ladder and had come into the hospital with an injury on his leg and had developed an infection in that injury. And so this physician was trying to treat it, and so he went and brought an antibiotic there to try to treat the infection, and it didn't work. So he tried another one, and another one, and another one. So he went through 6 different types of antibiotics, none of which were treating the infection. And the roofer, his patient, was getting worse and worse. And so finally he went for the last antibiotic that he could. It's what they consider their last resort antibiotic. And he told his patient, he said, we have one more to try, but it's going to kill your kidneys. So you have to decide now, do you want to be on dialysis for the rest of your life or amputate your leg? And so that's really where we are right now. It's less than 100 years since Alexander Fleming even discovered penicillin, and we're already at a point where people have to start worrying again about whether they can treat strep throat or they can treat a skin knee. And it's not just me saying this. The World Health Organization, the American Academy of Physicians, pediatricians, American Medical Association, everybody is very concerned about the crisis that we have with antibiotic resistance. 2 million people in this country every year are sickened by antibiotic-resistant infections. 23,000 people die of those infections every year. And so, as Chris had talked about, it's all of the uses of antibiotics can create antibiotic-resistant bacteria. So why do we worry so much about the farms? And again, as you mentioned, 70% of the medically important antibiotics that we use, 70% of medically important, meaning the ones that we use in humans to treat human illnesses, 70% are sold for use in animals. And so, doctors and nurses in hospitals, they put so much effort into making sure that you've got the right antibiotic and taking the right dose and taking it for the right amount of time. And as another infectious disease doctor said to me, he's like, all of these efforts, it's like a spit in the bucket compared to the fact that we're ignoring the 70% of antibiotics that are being used in animals. So what are the laws that we have to deal with this? The Food and Drug Administration has the authority under the Federal Food, Drug, and Cosmetics Act to approve drugs for use. And they're supposed to only approve drugs that are safe and effective. And then if they reach the market and then are later found to not be safe or effective, then they are required to withdraw those drugs off the market. So in the 1950s, antibiotics began being used in animal agriculture. And by the 1970s, the FDA started having some serious concerns about these uses. And so in 1978, they actually proposed to have hearings to withdraw especially the penicillins and the tetracyclines from animal use because of these concerns with resistance. In these hearings, the companies were supposed to then present evidence and try to prove that their drugs were safe and effective. And if they couldn't make that proof, then they would come off the market. Unfortunately, none of these hearings actually took place. So 40 years goes by, they still stay on the market. We've been using them in animal agriculture. Uses continue to go up, and FDA didn't do anything about it. So in 2010, the attorneys from NRDC actually sued FDA to force them to comply with the law, to make them hold these hearings and withdraw these products from the market. We won in the lower courts in the Southern District of New York, but unfortunately the Food and Drug Administration appealed that decision, and the Second Circuit ended up siding with them and overturned our win. And the Second Circuit, part of their reasoning was that FDA had argued that they were embarking on this voluntary program that would be a faster way to achieve significant reductions in antibiotic use. So let's talk about that program. It's called Guidance for Industry 209 and 213. And for anybody who's a lawyer who's done or taken administrative law in here, that should be a red flag. Guidance means that it's non-binding, it's non-enforceable, it does not have the force of law. So it's a very voluntary program. The companies could decide whether or not to actually comply with this guidance. That's the first problem. But more importantly, what Guidance 213 said was that it's inappropriate to use medically important antibiotics for production uses in animals. And the problem is the way that they've defined production use. So FDA said that you cannot use antibiotics for growth promotion, to make animals grow fatter and faster. But you can use them for what's called disease prevention. And I know disease prevention sounds like a great thing, and it is. We take vitamin C when we feel bad, or we wash our hands, we make sure we get enough rest, and all these things to do to try to prevent disease. And in Europe, where they have really good antibiotic stewardship programs in animals, the goal is to prevent disease to avoid using antibiotics. And that's the exact opposite of what the FDA is doing. They're using antibiotics to prevent disease. And the doses at which you would use for antibiotics for disease prevention are very low doses. It's below the dose you would use if you're actually treating an illness. And it's done on a very routine basis. They put it in their feed. And the animals are just eating a low dose of it all the time. And that is the riskiest way to create antibiotic-resistant bacteria. And as it also turns out, the doses that you use for growth promotion are the same as the doses you would use for disease prevention, or extremely similar. Oftentimes they're overlapping because it's a range of doses. And so a lot of people would be able to say, fine, we won't use this for growth promotion. I'm using this for disease prevention, and not actually change their practices at all. And so let's just recall that the Second Circuit had said that the reason why they were siding with the FDA is because this voluntary program was going to reduce antibiotic use more quickly. So in 2010 is when FDA drafted Guidance 213. They finalized it in 2013. And in 2014, sales of antibiotic use in animals went up 3%. So at the same time all of this is happening, we're getting all of this new evidence, the amazing work that Chris and Yvonne have done to show how antibiotic-resistant bacteria are traveling off the farm into our human populations. We've got more evidence that the use of one antibiotic could actually select for resistance in multiple antibiotics. We've also shown that the exposure to antibiotics might actually increase the rate at which bacteria will transfer their resistance genes to other bacteria, including bacteria of different species. And so with all of this evidence and everything that's happening, so the next thing that NRDC has done is just last month, we, along with our partner groups, filed a citizen petition with the FDA, asking them to withdraw the medically important uses of medically important antibiotics from use in animal agriculture, and but to only allow it to be used to treat sick animals, because in the end we think that is absolutely appropriate. You do want to use antibiotics to treat sick animals, you just don't want to use it for this disease prevention use. So, given FDA's history of not doing anything for decades, we are probably expecting that they're going to ignore us for a while. So, there are some things that we could do, maybe, eventually sue them to actually respond to our petition, which they're required to do by law, but we'll cross that bridge when we get to it. So what can be done in the meantime? Well, we're waiting for the federal government to actually take some substantive action. we can get the states to do some work. So California just last year passed the first law banning the medical use of antibiotics for disease prevention. The governor was instrumental in getting that law passed. We're hoping that there'll be similar laws in Maryland and in Oregon, hopefully soon. We've also been working to push the industry to change, and so what we've done that by going, pushing retailers like Subway and Taco Bell and Wendy's, and you may have seen, in the ads and stuff that these companies are starting to say that they're only supplying chicken that's raised without the use of antibiotics, medically important antibiotics. We've worked with the largest school districts to get them to start providing chicken that's raised without antibiotics for school lunches and other procurement programs all over the country. And these are ways to try to get the industry to shift on its own on the supply side. And there are companies like Purdue and like Tyson's that are starting to make those changes, but there are still companies like Sanderson and like Smithfield who need to make some serious changes, and they're resisting that. And in our conversations with them, what they say to us is, the science really isn't there yet. We don't think that there's enough evidence to prove that we're the problem. And we try to show them all the research that Chris has done. We show them all the decades of research that shows that it can get from the resistant bacteria can get from animals into humans and make humans sick. And they're like, unless you can show me that this farmer gave this antibiotic to this animal that turned this bacteria resistant and then that bacteria made that person sick, I don't think we're the problem. And I would venture to guess with the scientists in the room today that you would say that that's a pretty difficult study to develop. And we will keep working and keep trying to work with scientists to build up the evidence. There's a scientist in DC named Lance Price who's doing genetic markers and stuff that I can't describe because I'll get it all wrong and I'm not going to do it. But he's trying to show that women's UTI, the bacteria that's causing UTI, actually is the exact same one from the chicken that you can buy on the shelves in the grocery store, and these kinds of things. But this is, I guess, my plea to you in the room is we need more. We need to keep building that science. We need you out there in the labs doing the same kind of amazing work that Chris and Devon are doing. We need to clone them, but we need y'all to do more of that. We need, just to keep building up this research. But we also need you to join us in advocacy and to help make this case. And so, for example, at NRDC, we've got a PhD microbiologist on staff who works with us on this, and she's helping us understand the scientific literature. She's helping design study plans and write reports and talking to reporters and all of this stuff, working with the FDA, trying to help bring more of the science to the decision makers. And so that's kind of where we are right now, and hopefully we can all work together to push us in the right direction to deal with this problem. Thank you.